What's up everyone, welcome back to my channel. In today's video, I'm going to be recapping my family medicine rotation. Let's start with my schedule. So I worked Monday through Friday, no weekends, no call. The clinic was open on Saturday and Sunday, but my preceptor didn't make me come in, and I think he only worked one of those weekends while I was there with him. But we started about 8 a.m., we'd finish by 5 p.m. Wednesdays were really nice because we'd end at noon. And then my preceptor, who was also board certified in internal medicine, would go over to the hospital and do his hospitalist job. So I got the whole afternoon off. So that was really awesome, having an entire Wednesday afternoon to myself to either study or just come home, watch TV and relax. The best part about this rotation was definitely my preceptor. I would say he's been the best preceptor I've had to date. He was just really fun to interact with. He was great with patients. And somehow, along with seeing 20 patients a day, he would find plenty of time to teach me a lot of stuff. He loved doing these differential diagnoses lists. So say we saw a patient with diarrhea, he would come out of the room, get a piece of paper out, number 1 through 15, and be like, all right, 15 things that cause diarrhea. And then I would write down as many as I could. Usually I'd have 2 or 3 left where I was just reaching for anything, and whatever diagnosis I wrote down was just crazy, but he was a lot of fun to work with. Like I just mentioned, being done at 12 on Wednesdays was a huge plus. We also had plenty of free lunches on this rotation, so being in family medicine and prescribing a whole array of drugs, you get a lot of drug reps that come in and talk about their products. So we would probably have on average 4 drug reps a week bringing in their stuff and then supplying lunch for the entire office. So their free food was amazing. I ate it every single day, and then the days that they didn't bring food, my preceptor would treat me to something local, and he always offered to pay for it. He would never let me pay. So not having to meal prep was awesome. I miss it already, being in this new rotation. If you don't have to meal prep for rotation, that's huge. It takes so much time on Sundays. It's one less thing you have to worry about if you don't have to do it. So that was a huge plus. The worst part about this rotation would have to be all of the standing that I did. So my preceptor, his little workstation was in between patient rooms, and his computer was up on the wall. We would stand for the entire day, like 9 straight hours. And it took me about a week for my legs to get used to all the standing. So I know the first few days I came home and my legs hurt so bad, and literally it felt like growing pains again, like I had in high school. The other negative thing about this rotation is that I didn't have any access to the EHR. So while my preceptor was good at describing our next patient to me, and I could look over his shoulder at everything he was doing, I didn't have that experience of actually clicking through the EHR. I mean, he used Epic, which is really, among the electronic health records, it's pretty good. But I didn't have that opportunity to really get comfortable with Epic. There were a few times when I would see a patient, he would tell me to write up the note, do the review of systems and the physical exam and everything on Epic. So that was nice, but it's not something that I did routinely. So how to prepare for this rotation as a PA student. If you're watching this right now and you have yet to do family medicine, this is what you need to know for sure. Your head, ears, eyes, nose, and throat section. So if you're doing the PA/EA exams and you have that topic list, you'll notice that in family medicine, there's a huge amount of information that goes towards HEENT, whereas internal medicine, there's none of that. That's probably the main difference between the two. The rest of it is very similar, but know your sinus infections, your ear infection and sore throat, what bugs cause those things, how to diagnose them, and absolutely how to treat them. Know your United States Preventative Services Task Force, it's a mouthful, USPSTF recommendations. So for example, when do you start screening women with pap smears, right? 21 years old to 30, every 3 years. After 30, it's every 5 years plus HPV until the age of, I'm gonna get this wrong, 75, I think. But things like that, know your recommendations for screening, like colon cancer, like cervical cancer that I just mentioned, mammograms, all those screenings you definitely should know. Know diabetes pretty well, especially type 2, what's first line, and then some of those second line drugs. I know it gets a little convoluted and there's a ton of them, but know a few of those, and then how to treat hypertension, the main drugs, when to use them, what their indications are, side effects, that whole thing. So what I saw a lot of on this rotation were annual physicals. My preceptor was really good about getting his patients in yearly and then screening them with EKGs if they had a cardiac history or over the age of 50, getting colonoscopies for their patients at the age of 50, low-dose CT for those who had a prior smoking history and qualified for it. So I learned a lot of preventative medicine on this rotation, that's for sure. The rest was mostly upper respiratory stuff, whether that be viruses or the flu, which we diagnosed a lot of. That is just a quick recap of what I experienced on my family medicine rotation. Stay tuned next month for when I cover pediatrics. Thank you all for watching. If you haven't yet, please do me a huge favor, like and subscribe to my channel, and I hope you all have a wonderful day.